Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Can jet lag disrupt our metabolism? A new study from the University of Surrey and the University of Aberdeen has found that disruption to our body's clock, such as those experienced during jet lag, impact our metabolism, but to a lesser extent than sleepiness and the primary clock in the brain. Findings are published in iScience. The research involved a controlled experiment where participants experienced a 5-hour delay in their bedtime and meal times. The study highlights that the time shifts lead to number 1, reduced energy spent processing meals, number 2, changes in blood sugar and fat levels, number 3, slower release of breakfast contents from the stomach. These metabolic effects are temporary, however, and mostly recovered within 2-3 days of the 5-hour time delay. Earlier diabetes diagnosis may be associated with dementia risk. People diagnosed with type 2 diabetes at a younger age are at a higher risk for developing dementia than those diagnosed later in life, according to a study led by researchers at the NYU Rory Mayers College of Nursing. The findings published in PLOS One show that the increased risk is especially pronounced among adults with obesity. Our study suggests that there may be cognitive consequences to earlier onset type 2 diabetes, and it points to the need for strategies to prevent dementia that consider both diabetes and obesity, said Xiang He, assistant professor at NYU Mayers and the study's first author. To understand how the timing of type 2 diabetes diagnosis relates to dementia risk, the research team analyzed data from 2002 to 2016 in the Health and Retirement Study, a longitudinal study conducted by the University of Michigan Institute for Social Research. The study included 1213 US adults aged 50 and over with type 2 diabetes confirmed by blood test and no dementia upon joining the study. Following participants for up to 14 years, 216 developed dementia based on follow-up telephone interviews. 90% pregnant females might not be getting sufficient nutrients from diet. It's generally estimated that around 10% of pregnant people struggle to meet their nutritional needs, but the real number could be far high, according to new research from Stevens Institute of Technology. According to a recent study published in the Journal of Nutrition, over 90% of pregnant individuals are potentially failing to get enough iron, vitamin D or vitamin E from the food they eat, while over 1/3 could be short of calcium, vitamin C and vitamin A. Troublingly, almost 2/3 of pregnant people were also found to be getting insufficient dietary folate, a critical nutrient that helps prevent birth defects in the baby's brain and spine. The Stevens team asked pregnant people to take before and after photos of everything they ate over 2 14-day periods. Experts then reviewed the photos to assess the amount of food actually eaten and determine the nutrients consumed during each meal. Adolescent psychotic-like experiences may be tied to depression and self-destructive behavior. According to a study recently conducted at the University of Helsinki and HUS Helsinki University Hospital, psychotic-like experiences are abundant among adolescents referred to care, but are generally considered fairly neutral, with only some of the adolescents reporting them as frightening, worrisome or harmful. In the study, the correlation between psychotic-like experiences and depressive symptoms turned out to be strong. This link was not explained by connections between individual psychotic-like experiences and depressive symptoms, but by factors that more broadly measure paranoia and unusual thoughts. In addition to depressive symptoms, paranoid thoughts and unusual thought content were also associated with self-destructive thinking. The findings show that psychotic-like experiences should be systematically surveyed in all adolescents seeking psychiatric care. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.